Okay, and Teresa, are we live?
Yes.
Okay. Alrighty. So let's begin with the approval of the minutes for January 4th, 2021, January 14th, 2021, and January 28th, 2021. These are all emailed to you in advance. So does anyone have any corrections or additions to the minutes as presented? If not, the minutes will be approved as provided and presented.
Okay.
And we'll move on to the next item on the agenda. Transfers. We have in the county general fund, $1,500 from Social Security to stipend, and that is within the Perry County Commissioner's budget. Pam, can you do a quick explainer on that?
Yes, at budget time when you guys were doing the, trying to put the stipend on, and we went through and counted the numbers somewhere along the line when Tasha's now trying to get the numbers correct, we are missing 2. So to make sure, and we were trying to do things in a hurry, thought we had everything correct. So that's what it is. It's just 2 employees we need to make sure to put on here so we catch everybody.
Gotcha.
Luke, I've got a question.
Sure.
Pam, has the stipend been paid out yet?
It will be paid out on Monday.
Okay, thank you.
It will be a separate deposit than their paycheck, because we did do it separately than their regular pay.
All
So
right,
on
thank
Monday,
you.
people should be seeing 2 deposits.
I'll make a motion to approve that.
All right, I got a motion on the floor. Do I have a second?
I'll second.
second.
I think that was Lynn who seconded that first. All right, we have a motion and a second to approve the $1,500 transfer. I will do a roll call vote. Charlie?
Yeah,
Danny is not here, which I forgot to do roll call at the beginning, so sorry about that. David?
Yay.
Lynn?
Yay.
Paul?
Yay.
I will vote aye as well. And Erla?
Aye.
All right, ayes have it, and the motion passes 6-0.
Okay.
Next on the agenda is additional appropriation request. The first one we have is within the county general fund under the Perry County Council budget, and it is $9,000 for ambulance service. And this is
Sorry for being late.
oh, hey Danny, welcome.
AT&T just decided to wonk me out here. So anyway, I'm
All right,
good.
we just moved on to additional appropriations. This $9,000 additional appropriation for ambulance service is $9,000 left over of CARES Act money. That CARES Act money was transferred to the general fund, and so now we have to appropriate it out of the general fund, and that is $9,000 we promised to appropriate during our December meeting, I believe, when we were discussing leftover CARES Act money. So if anyone has any questions, or if you don't have any questions, I would entertain a motion on that.
Hey, Luke,
I'll make-
does this zero out the CARES balance in?
No. We had this $9,000 appropriation, and then we have our next appropriation, which is $11,415. And then after that appropriation, we will have about $1,500 of CARES Act money left.
Okay.
So, yeah.
I'll make a motion.
Okay, got a motion on the floor. Do I have a second?
I'll second.
Uh-oh.
I
I don't
beat
know who
him.
that was.
It's
We
David.
don't either.
David says he beat him.
David's slow.
All right. I've got a motion and a second on approving the additional appropriation of $9,000. I will take a roll call vote. Charlie?
Yeah,
Danny?
Yeah.
David?
Aye.
Lynn?
Aye.
Paul?
Aye.
I will vote aye as well. And Erla?
Aye.
Motion passes 7-0 to approve an additional $9,000 for the ambulance service. All righty. Next on the agenda is under the Perry County Commissioner's budget in the general fund. It is $9,604 for overtime pay, $735 for Social Security, and $1,076 for retirement, for a total of $11,415. And this is overtime pay for the health department that will get them paid from December 28th to January 30th. Does anyone have any questions about that? And if not, I'd entertain a motion.
I'll make a motion to approve that.
We got a motion from David. Do I have a second?
I'll
I'll
second.
second.
So,
I beat him.
Go
Okay,
ahead.
we'll go to
Yeah,
Erla.
she did. Erla, ladies first.
Okay,
right, does-
thank you.
Does anyone have any questions on this appropriation in specific? If not, I will take a roll call vote. Charlie,
Aye.
Danny,
Aye.
David,
Aye.
Lynn,
Aye.
Paul.
Aye.
I will vote aye as well, and Erla.
Aye.
Motion passes 7-0 to appropriate an additional $11,415 for overtime pay. Our next additional appropriation is within the Sales Disclosure Fund, the Perry County Assessor budget, $1,823 for office equipment. And this is for to purchase sit-to-standing workstations and chairs. And it doesn't look like Mindy's on, so
He was supposed to be, I don't know, something must have happened.
Hold on,
Okay.
she's trying to connect, so let me get her connected. You may want to skip and come back to her in a minute.
okay, just 1 second. Okay, we will skip that really quickly. We'll come back to that after our next additional. So our next additional appropriation is the Drug-Free Community Fund. It is $5,921.58 for prevention and education, $6,921.58 for treatment and intervention, $5,694.58 for law enforcement justice, and $3,266.46 for administrative, for a total of $21,804.20. And this is from fees collected from drug and alcohol charges. And the Perry County Substance Abuse Committee administers the distribution of these funds to other agencies through grants. And this is their 2019 fees and the leftover of 2018 fees that we will be
Okay.
appropriating.
All this money is collected from fines and
Yeah.
things of that nature. Okay.
Yeah, fees collected from drug and alcohol charges.
Okay.
Yep, and
I'll
the
I'll
Perry,
make a motion to allow it.
okay.
I'll second.
Do we have, I don't know who that was. You guys gotta stop
Danny.
doing that.
Danny.
Okay,
I'll let
does anyone
Danny
have,
go.
a second by Danny, does anyone have any questions on this?
Yeah, just follow-up question. How often, like, will this occur, like quarterly or every 6 months, I wonder?
It is
Or
annually, Pam?
Yeah.
annual? Okay.
Yep, annually,
A
okay.
year.
Any other questions or discussion? If not, we have a motion and a second on the floor. I will take a roll call vote. Charlie,
Aye.
Danny,
Aye.
David,
Aye.
Lynn,
Aye.
Paul.
Aye.
I will vote aye as well, and Erla.
Aye.
Motion passes 7-0 to appropriate the additional $21,804.20 for the Drug-Free Community Fund. Okay, Mindy's back on. So we will go back to the previous additional request from the Sales Disclosure Fund in the Perry County Assessor budget for office equipment for $1,823. And Mindy is here to discuss that. Mindy, are you here?
Mindy.
Doesn't say that she's muted.
No, she's got a hand thing up. I don't know if that's blocking her or.
Well, this is,
She
Like
can
I said-
chat. If you want her to chat, does she have
Sure.
access to chat?
I think so. Wait. Now something's going on. As we know, I'll just reiterate, this is for to purchase sit-to-standing workstations and chairs. If we can't get Mindy on, if no one has any questions, I guess it's not that big of a deal.
Is this from within her budget or additional unappropriated money?
This is from the Sales Disclosure Fund. It's separate from the general fund. It's an assessor-specific fund
Okay.
that I guess she earns revenue from fees or something of that nature.
D transfers.
Deed transfers, okay.
Yes.
So does not affect the general fund or any other funds.
Right.
Does anyone want to make a motion?
I'll make a motion to allow it.
Okay. Do I have a second? All
I'll second.
right, Lynn seconded. We got a motion and a second. I will take a roll call vote. Charlie,
Aye.
Danny,
Aye.
David,
Aye.
Lynn,
Aye.
Paul.
Aye.
I will vote aye as well, and Erla.
Aye.
Motion passes 7-0 to appropriate the additional $1,823 for office equipment. Okay, our next appropriation request is in the inmate housing fund for the Perry County Sheriff, and it is $40,072.50 for lease payments for county sheriff's vehicles. And Alan and Eric are both here. If you guys want to
Eric,
give
you
us a little
go.
update.
Well, this is for the first lease payment for the lease that was presented to you from Sternberg's, and I think the sheriff had reported earlier that the trucks are starting to come in, and they are going to be upfitted. So it's going to be a little bit of time before we see them, but I'd say they're probably going to be on the road sooner than what we expect.
We should have 2 of them probably by the end of next week. But understand that we ordered these and this all came the first year in this year, not last year. So the county is going to pay, the Perry County Sheriff's Office is going to pay for the entire year. Does that make sense?
Yep. And then next year we will be splitting it, I believe.
That is
Yep.
correct.
And Paul, I don't know, you weren't here for this, but we're entering into a 5-year lease agreement, right, Alan and Eric?
That is
With
correct.
Sternberg to lease how many vehicles?
5.
5 sheriff's vehicles
Okay.
instead of buying them every year.
I was going to ask Alan, what's the normal usefulness of vehicle? 3 years, 5 years, 2 years, whatever, but.
Just depends, really, 4 to 5, but our fleet got in a bad shape, and it was time, and this was a good move for us. We felt, all of us, at that time, that this was a good move for us due to the current of the fleet is now.
Okay.
All right. Does anyone if no one has any other questions about that, I would entertain a motion.
I'll make a motion.
Do I have a second?
I'll second it.
Any discussion among the council members? If not, I will take a roll call vote. Charlie,
Aye.
Danny,
Aye.
David,
Aye.
Lynn,
Aye.
Paul.
Aye.
I will vote aye as well, and Erla.
Aye.
Motion passes 7-0 to appropriate additional $40,072.50 from the inmate housing fund. And Sheriff, welcome back. We're glad to see you.
Yes.
Eric, thanks for all you've done in his absence.
I appreciate that. I really do appreciate everybody stepping up during my absence. I'm still not back 100%, but I'm a lot. So please be patient with me, and I can't say enough to Eric, and everybody's really stepped up for us. I really appreciate that a lot.
Glad to hear it. Okay, moving on to the next item. It is the resolution for establishing policies and procedures to protect decorum and foster the effective administration of public meetings. This was introduced at our last meeting and read in full. Rod, do we have to do a reading by title only, or what's the procedures?
He's muted.
Oh, Rod, you're muted.
Mute. Sorry, I was talking. I thought I was muted. I think you've read it over once. It's up to you guys, but I think for sake of brevity, you could just highlight the various sections and then just go ahead and take a vote, or take comments on it, and then if somebody, if you want to vote on it.
Okay, I'll just do a little brief highlight. Resolution in part, we say we'll follow the general rules of parliamentary procedure set forth by Robert's Rules of Order, newly revised. Basically, it states that it gives specific procedures on how the public will interact with us at public meetings. For in-person meetings, they will sign a speaker registration sheet. We will have a public comment section, specifically give everyone a chance to speak before the council. During a virtual meeting, if we are still continuing those after this is passed, it will require the public can still interact with us. They can sign up in the auditors or with the auditors or county administration office by noon of the day of the meeting to sign up to speak with us. And they will receive a Zoom invite and to specifically for the meeting, and everyone else in the public can just watch via our YouTube channel. So it allows the public or it specifies how the public can still interact with us during these virtual meetings, and it sets standards for our in-person meetings. Does anyone have any questions or comments? If not, I would entertain, and this resolution does expire at year end. It's not a ordinance. It's not permanent. It expires at the year end. So we can give it a try and see how it works out for us.
Do we make a motion on that?
Yeah, we'll make a formal motion for its adoption.
I make the motion that we adopt this resolution.
I second that.
Do we have any discussion?
No.
David says no. Oh, I love that. All right. Well, if not, I will take a roll call vote on this. I had to write down everyone's name. Charlie.
Aye.
Danny.
Aye.
David.
Aye.
Lynn.
Aye.
Paul.
Aye.
I will vote aye as well. And Erla.
Aye.
Motion passes 7-0 to adopt the resolution to establish policies and procedures to protect decorum and foster the effective administration of public meetings. And this resolution will be available on the county website for the public to see. Teresa, please. I didn't ask you before. And Pam, do you have a final copy of this? Right?
I do. Mine says final draft across it. So can you get me a clean copy?
Yeah, I can do that.
Okay. And do you
Yeah.
want me just to, you guys, or do you want this one here probably, since it's a resolution for all of you to somehow we'll get signatures?
Sure.
Okay,
We'll somehow
that
do
way I
that.
have the original signatures as far as with it being a resolution, so.
Well, if the
Okay.
commissioners ever decide to open up the courthouse, we'll all be there.
Well,
Sign
it's, yeah, we'll find out Monday.
Hey,
Okay.
Luke, this is
Yes.
Teresa.
Yeah.
Where would you want this on the website? Do you want this on the council?
Yeah,
the
if you wouldn't
council
mind.
page?
Yeah.
Okay.
Yeah.
All
That'd be
right, no
perfect.
problem.
Thank you. Okay, that takes care of that item. Moving on to item number 5, discussion on health department overtime. So we had a work session 2 Fridays ago about this issue. We met with the health department the next Friday for about an hour and a half, I believe, or something like close to that. And they don't necessarily agree with this proposal to hire 2 temporary workers, but we have to do something to get us through this time. So does anyone have any comments or anything regarding this? So
I think I have a comment. I think it would have been nice had, the $700,000 that we received in the CARES Act money, had some of that been set aside and to provide for overtime, because I feel like, the health department, to me, that is one of the top priorities for that funding. So I think it would have been nice had I know it's hindsight and nothing to do about now, but it sure would have helped us out a lot.
Right. I agree with that wholeheartedly. And I'd like to discuss at our next meeting, maybe the CARES Act expenditures and the council to go over them and just kind of, because I don't really know if it's really been discussed that much. But I agree. I wish, of course, hindsight is 2020, but I wish more money would have been set aside for this specific purpose. But when we met with the health department, I brought up the fact that the commissioners at that time last year unilaterally amended the personnel policy handbook to on the vacation and comp time policies for the health department specifically. And from what I read, and Rod kind of he agreed with this, that there's a formal procedure to amend the personnel policy handbook in which ordinances have to be passed by both bodies, the council and commissioners. And they did not do that. And they allowed the health department to roll over their vacation. And they accepted them from the vacation and comp time policies. And I don't know what that means. Their motion that they made, instead of, they didn't pass an ordinance, they just made a motion. It was very vague and really unclear. And I think it kind of put us in a difficult position of figuring out what we're going to do, because the motion they made was To accept the health department from the current policies on vacation and comp time, leave it wide open, and to revisit the situation every month. I think that was super unclear and put us, and there's no time limit. So it just has put us in a very difficult situation. And as far as I can tell, it was never revisited, according to the minutes of the commissioners meeting. So I wish we would have been consulted on that, and we could have been more involved in that discussion. But now we have to figure out a way to move on and fix the situation. So I would like to see the commissioners retroactively at least pass an ordinance to what they wanted to do at that time. And then now, since the CARES Act money is gone, and the personnel policy states that if overtime funds have not been appropriated, the employees will receive comp time. So right now we're out of CARES Act money, except for that we have $1,500 of CARES Act money left, which is not that much, but the health department is still working overtime, and we don't have an established funding source for that. So I would like to, first of all, appropriate enough money to pay them for the overtime they worked from January 31st to February 28th, I believe is the end of the next pay period, or the 27th, and use the $1,500 of CARES Act money that's remaining, and we will use the unappropriated balance of the health fund to pay what is left.
What do we have in that health fund? Is it 9,000?
The health fund has 77,000 unappropriated.
Oh, 77,000.
Yeah. So to pay them for what they have worked, so which would be January 31st to the end of the pay period, which would be February 27th, we can use the $1,500 of CARES Act money, and we can use the health fund for whatever else to make that up. And then from there, I think we need to appropriate an overtime amount, and then allow them to work up until that amount is drained, and then we can revisit it as needed. Because it doesn't make sense for them to work overtime and then for us to appropriate to pay for it. It should, in my opinion, it should be the other way. We appropriate a balance, and then they work until that balance is taken up, and then we can reappropriate as needed. But it says if overtimes are not appropriated, they work comp time. And right now we don't have a overtime funds appropriated. So we need to appropriate first so they can earn the overtime, in my opinion.
Do we have an estimate of what it will cost to pay them through the 27th of February?
I haven't worked anything up yet.
Okay.
And it should be going down, as you've mentioned before, David, and it's going to be less, but to me, it doesn't make sense to leave it wide open, because first of all, the personnel policy is kind of contradicting the personnel policy in my handbook. It says if overtime funds have not been appropriated, which they have not been, then they should be earning comp time. So if we want them to earn overtime, we need to appropriate a balance first, and then allow them to work and earn that overtime from that balance, in my opinion. Anyone have any thoughts?
I wasn't there at the work meeting. I did go back and watch the Zoom, and I've read all the information that was sent. So the one county that's not doing contact tracing, is that something our health department is looking at maybe discontinuing, because it sounds like that's where most of the overtime's coming at?
Right. I honestly am not 100% sure. I think now that we're having less and less cases, contact tracing isn't as big a part of it anymore. I think now it's more of the vaccination clinics that they're doing, and that's kind of how they explained it when we met with them. But yeah, I reached out to Du Bois. I reached out to a lot of counties, and Du Bois County told me that they basically stopped contact tracing. And I don't know if they're giving it to the state to take over or what, but they said, yeah, go ahead.
I could see where that's where that overtime comes at, because like one of them was saying in the information is, they get a positive result at night. So they're working at night, they're working on the weekend. So that would, to me, alleviate some of it if they do that.
Right. Yeah, and Du Bois County said time constraints and funding, they can't afford to keep doing overtime and contact tracing. So yeah, they are basically stopping comp time or stopping contact tracing. I don't know what they're doing specifically I don't know if the state's taking over or what. But is anyone?
Is that something that has to be done? Is that something they?
I have no idea, honestly.
Is it my understanding that the schools are doing a lot of their contact tracing themselves, like the schools? Someone told me that.
I'm not 100% sure. But does anyone have any other thoughts about what to do about the situation or any suggestions?
Go ahead.
I feel like if we do alleviate the contact tracing, that's where, if they're doing the vaccinations, they can set their time for the vaccination. And then that, they can schedule that, where the contact tracing is something you can't really schedule. So if they do eliminate that, I feel like that would possibly take care of most of the overtime. But that's something that the state requires. I mean, I understand it is important, but if we can't afford it, I mean.
And I think they said a lot of it now is just they're doing a lot of vaccinations. So that goes until 7 p.m. So they're automatically working overtime for vaccination clinics as well. So
we're fortunate that the numbers are going down. So, and at a recent meeting, we proposed some ideas that really we didn't really get a clear idea of what direction to go. That was my understanding.
Right. And so I think we need to appropriate it. That's why I think we need to appropriate a certain amount and then still try to figure out, see if there's any other solutions we can think of during that time frame while they're working overtime. See if we can figure out something else to do or to help them out.
So are we talking about?
Go on, David. I'm sorry.
Are we talking about appropriating to pay them through the 27th, then plus a balance to carry forward?
That's kind of my thought, because I don't know what to do.
Appropriate to pay them through the 27th and maybe another, what, $10,000?
Yeah, I think that's a good, from the unappropriated balance in the health fund. Yes, that's kind of my thought. And then that can give us time to see if we can figure out a solution or what it's looking like. Is it still work? Is it still that much that they're working, or because we have another situation is their vacation time, that's stacked up. So we have to figure out how we can allow them to take off, or so there's a lot. This is overtime and it's vacation. We've got to figure out a solution for that.
And we talked about volunteers to help with that, but I don't know where we got with that.
Well, we didn't get anywhere with it, really.
And so the reason
they're using some volunteers, I think, already.
Yeah, for the vaccination clinic. Yeah.
Vaccination. Yeah.
So the reason why they don't want to hire part-time is because
they felt like with the cases declining, that maybe it wouldn't be as much help as we thought it would be, because if there's not a lot of cases to trace, then what are they going to be doing? And I asked if there was other administrative duties that they could do throughout the department, and they didn't really think of many. They thought, well, really what we need is they need an RN, basically another nurse that could help them with immunizations and stuff of that nature. So they just didn't feel like the temporary workers would really help the situation as much as I thought it would. So, and so maybe that's another solution that we need to look at. Maybe if we can find a retired nurse who can work, we can hire temporarily to work at a lower rate to help them with vaccinations on Wednesdays, so one of them can take off. I don't know. But for now, right, what we got to do right now is appropriate to pay them up to the 28th or 27th. And then I think what we need to do is appropriate a balance of overtime. And that can give us time to work out a solution maybe.
So is Wednesdays the only time they're staying later?
Wednesdays is the clinic, I believe. I think it's only one day a week right now. And then they just contact trace when they get the calls,
I believe they also sometimes stay over to catch up on other vaccinations and stuff like that as well. So
gotcha. Yeah, because they still have all their childhood immunizations they have to do and stuff of that nature too. So, but definitely on Wednesdays for sure. So I would just entertain a motion to pay the overtime for the time frame of January 31st to February 28th or 27th, using the $1,500 remaining of CARES Act money and the unappropriated balance of the health fund.
I'll make that motion.
Okay, do I have a second?
I'll second it.
All right, so do we have any discussion on this? So this will get them from January 30th, January 31st to the end of February for overtime pay that they have worked.
It'll
There's-
bring us current what we'll do.
Yeah, and then, yeah. So
Only-
there's no, go ahead, sorry.
Something too. Another idea that came out of that meeting, just so that we're aware of it, is they've got 2 individuals there that were excluded from the overtime that could actually do contact tracing for them at a lower rate. So I'm going to bring that to the commissioners to see if they would, if we can allow them to have some of the overtime as well. That way it's at a lower rate and doesn't cost
Right.
us to do the same. So
Yeah, we can discuss, we'll discuss that in a second.
Okay,
We'll go ahead and vote on this motion first, and we can discuss that after this. So I will take a roll call vote. We have Charlie,
Aye.
Danny. Danny, you're muted, by the way.
Aye.
David,
Aye.
Lynn,
aye.
Paul,
Aye.
I will vote aye as well, and Erla.
Aye.
Motion passes 7-0 for a motion of intent to appropriate $1,500 from the CARES Act fund and the remaining balance from the unappropriated health fund
Okay,
balance.
and once we get through this weekend, then I will see if we can go ahead and get a number of the hours, so that way Monday and Tuesday, Tosh and I will get it worked up, so you guys have an idea of what this cost is gonna be.
Okay.
Okay.
So going kind of back to Greg's point, so now we have to figure out what we're going to do from the end of the February pay period for the foreseeable future. And I don't see why we couldn't allow the other 2 employees in the health department to work overtime. Because from the motion they made, they said the health department. So they didn't specify the 2 health nurses and the sanitarian. They just said the health department. So that's what I'm looking at right now.
that's my understanding of it then. So
Yeah, so
the understanding we had at the work session too, though. So
yeah, I'm rereading it now and I'm saying, oh, it says the health department. So I don't know why they couldn't have earned overtime at that point. I like I said, the commissioner's motion was very vague and I still don't know exactly what it meant.
Just quick questions, Luke.
Sure, yeah.
Does it have to be an RN to give the vaccine? Because like CVS's, Kroger, those different places are starting to give the vaccine. Are
No,
they trained
it doesn't
people?
have, it doesn't have to be an RN.
So why couldn't a temporary person be someone trained to give the vaccine? Why would they have to just do administrative duties?
It usually has to be someone like and Erla probably knows better than me. I'm gonna let her speak, but it usually has to be a nurse or a pharmacist or somebody like that.
Right. It could be an LPN.
Okay.
Or
So maybe that's something we can look at as well.
And
So
they do have volunteers doing that. I'm sorry, Lynn. They do have volunteers doing that. Like Garrett's doing that, and I think there's also a retired nurse that's doing that, or one that's not working full time.
There's a couple, yeah.
I just didn't know, because I know CVS's are going to start giving vaccines. So are they hiring, that's the reason why I'm like, are they training their staff back in the pharmacy to give vaccines? Is it something we could do? Is train a person or a couple of people, like could Danielle and Gail be trained to give a vaccination? I wasn't for sure, just asking.
I have no idea. Erla, can you?
I would think at CVS, the pharmacist is going to be giving them, but I might be wrong. But I wouldn't want the liability of someone that hasn't been properly educated on it.
Okay.
That would be a liability if something went wrong.
My understanding of CVS is they actually hired a pharmacist that used to work there. That's all he's going to do.
Just to give vaccinations. And are they doing vaccinations every day or just Wednesday?
COVID vaccinations are happening on Wednesdays. And then, but they
Wednesday
still have all their other vaccinations, their childhood vaccinations and all the other stuff that they do throughout the
throughout
week as
the week. Okay.
Right. So maybe that is something we can see if we can hire a retired nurse or an LPN or something temporarily to maybe help out with vaccinations so they can start using their vacation.
I know Perry County Memorial Hospital was using a retired nurse the other day when I went to get mine. Becky
Gotcha.
Hebert.
I just can see them getting burnt out because after, I mean,
Right.
they've pretty well been going through this a year.
Right.
And I mean, and not having a vacation and, you know, the weekends that, I mean, they're not even probably getting the days off they deserve. So.
Right. Yeah. And burnout was discussed at our Friday meeting with them as well. So we know it's an issue. We just have to figure out how we can alleviate it. So right now I would entertain a motion to appropriate a certain amount of overtime. I don't know what that would be, what your thoughts are, to allow them to work the overtime. And then we can revisit it as needed. If anyone has any thoughts on that.
So are you looking for a dollar value? I
Oh
assume?
yeah, we need to appropriate a certain amount of overtime, I believe.
Well, do we have any idea or estimate on how long what we have appropriated tonight will last?
Just through
Based
the
on-
end of this week.
Till Saturday. What you guys appropriated to pay them, because today's the 25th, so it will take it till Saturday. So I have to wait till after Saturday to see what they've worked, to see what kind of numbers that we'll be paying out from the first motion.
Okay.
And like we said, it should be going down, but we don't really know. So if anyone does anyone have any thoughts on a specific dollar amount of overtime to appropriate for Sunday onward?
I have no idea.
No, but I do think we need to look into this contact tracing. That seems to be, you know, if that's something we can get out of, we need to.
Yeah, I think especially when DuBois County told me that, I didn't even know, you know, you could do that, but I guess the state can take that on. It's what I understand at least. But I agree, if that can help alleviate some of their, you know, working weekends, and I think that's something to consider.
Yeah, because if you took away the contact tracing, it would just be the Wednesday till 7.
Right,
Because
and then any
normally
other
what?
times I
Normally-
would just say late. Yeah, I think
Yeah.
I mean that's true. So that's something we can have a discussion with them.
With the COVID cases going down, and if we do stop contact tracing, would $10,000 be a reasonable figure to try for?
Your guess is as good as mine at this point, but I
And
think
how-
it's
I don't think we can know that until Pam gives us some numbers.
Well, I think we need to make an effort to do something.
because if we don't do one now, they're just gonna, we don't have any limits on it, and it'll just keep racking up. And if $10,000 isn't enough, or if we at our next meeting we can discuss it and reappropriate as needed, but I think we need to set a definitive, you know, amount of money, and we can revisit as needed. Because like I said, personnel policy says if overtime is appropriated, they can earn it. If it's not appropriated, they earn comp time. So I think to be in line with the personnel policy, we need to appropriate overtime so they can earn it. So David,
Would it be much to ask that if the council here in this motion, that let's say as a week goes by, that we could get those numbers for them to see how far of this money we've used so far?
yeah, just so we know. So
Yeah.
after this week, we can see what the numbers are, and then we'll figure out if what we appropriate now is enough or what we need
Right,
to do.
because this way by next Friday or the following Monday, if I can get the numbers for what this last week was, or next week is, then we'll have an idea where we're sitting at with this 10,000, how far it's gonna take us.
And if we need to have a special session because for some reason they earn $10,000 of comp time in 2 weeks, we can.
Yeah, and
So-
that might be our best bet to go.
I think so too. So David, if I would entertain a motion from you, if along those
I will make
lines.
the motion for the $10,000.
Okay, so we have a motion of intent to appropriate $10,000 for overtime.
From the health fund.
Okay, from the unappropriated health fund balance.
Now, are you saying just 10,000 total for the social security and the retirement, or you want 10,000 strictly for the overtime pay?
Well,
think-
I was thinking more overtime pay, I think, but so
Okay.
then it would be additional for the social security.
Right.
which-
Well, that's what I wanted to make sure, because otherwise it does it a little different.
Right.
So we're
Okay.
gonna do just, so your motion is just $10,000 in pay alone, not including social security and retirement?
Well, I think we need to include social security and retirement.
I think so too. So,
Well, okay, social security would be $765 at 10,000. And retirement would be $1,120.
Make it 13,000.
David, you want to
I
amend
can
your
amend
motion?
my motion to make it 13,000
Okay,
to
So-
include the salary plus social security and retirement.
okay, so we've got a motion on the floor to appropriate $13,000 from the unappropriated health fund balance for social security, retirement, and pay.
Okay.
Do I have a second on that motion?
I'll second it.
I'll second.
I got a second by either Earl or Danny. I don't know which one it was.
Oh,
It
really?
doesn't matter.
All right, I'll take a roll call vote. Charlie,
Aye.
Danny,
Aye.
David,
Aye.
Lynn,
Aye.
Paul.
Aye.
I will vote aye as well, and Erla.
Aye.
Motion carries 7-0 to appropriate, for a motion of intent to appropriate $13,000 to cover overtime and benefits for the health department.
Now, are you, okay, so let me make this clear. When I ask for this time, are you saying for all employees up there, or are you still staying with the 3?
I would say any of them with overtime. We need to know that.
Starting January or February the 28th then? All employees, you're saying, starting February the 28th?
That's how it reads to me what the commissioners said. I mean, they said the health department, they didn't specify employees. So from that, I don't know if it's right to really exclude.
Okay, well, I just want to make sure, because when I ask, it's going to make a difference. So that's why I need to
Right,
know.
yeah, it will, yeah. I think that's, once again, I'm confused by the commissioner's motion. I don't know what it really means.
Okay, so I will get overtime figures from all of them starting February 28th. The other girls, we can't go back on, but we'll
Right.
start you're saying
Yes,
February 28th. Okay.
yeah, and that
All right.
allows the other ones to
Yeah.
work overtime if needed to help alleviate some time from the other ones.
Okay, I just want to make sure I was clear on whenever I asked for the time.
Yeah, and I think I will need to go to the commissioners meeting and ask for clarification and ask them to formally go back and pass an ordinance from what they wanted to do, so we can get this cleared up, because it's confusing to me and they said that this is something for the council to think about. Well, I didn't even really know about it until it was all the CARES Act money was gone. So I think this needs to be cleared up, and I think we'll get it cleared up.
Luke, from our last Friday meeting, I got the impression that Tara and Sarah and Kim kind of welcomed the other two performing some of the overtime duties.
Yeah, I think so. I mean, it's anything to help them alleviate all the time they're working. I think
Right.
they'll appreciate.
Yeah, their comment was they thought that they were excluded, and they were excluded from it, but they were open to having them help.
Yeah, and from what I'm reading, I don't understand why the others were excluded. I don't get it.
May not, it may be a misunderstanding. Who knows?
Yeah, I don't know. Okay,
Mike?
so yeah, go
Well,
ahead, man.
I'm sorry.
You're
Is,
fine.
when does this, I don't want them to feel like we're discounting all their hard work. They have done a great job, but
Right.
like, are we going to keep did they have any other ideas on to help alleviate some of this overtime, or are they just doing what they feel like they need to do and this is what they have to do?
Well, one of the ideas that came out of that meeting with them was hiring an either retired nurse or an LPN or someone who could help them with vaccinations. Because if we hire someone who can give vaccinations, that they could come into work for 8 hours a day and let someone take off, and start using their vacation time. They just felt like I said, that the temporary workers wouldn't really help the situation. And that was their thoughts. And then allowing the other two in the office to earn comp time, because they said they felt bad, giving the other two contact tracing when they weren't earning overtime. So
Right.
they were earning comp time.
I know 77,000 is not a lot of money, and
No,
we're
it is
in
not.
February.
Yeah.
So I'm just worried. I mean, I know our budget's tight,
Right.
don't have a lot, and it's like, what are we gonna do once this money runs out?
Right. And I
you
hope
know,
we don't get to that point. But I think you raise a good point, Lynn.
Because
yeah.
you watch the news, they're looking at next year still, so I mean, hopefully maybe the state will give us more money. I don't know.
Right. That's something we can talk about during miscellaneous, actually. But yeah, I mean, 77,000 is not a lot of money. But I think
Luke, I have a question.
Sure.
Excuse me.
No.
Between now and our next meeting, is there any possibility that you could talk to, especially the health nurses, and maybe Erla could help out on this, some suggestions of maybe some retired nurses that might be willing to do this?
Yeah, Erla, I mean.
Yeah, and I just thought of something else too. Med techs are taught to give injections. And they would work at a lesser pay. A lot of your employees at the clinic are actually, people think they're nurses, but they're not. They're med techs, a lot of them.
Okay.
And that would be a lesson. Yeah.
Yeah.
I just think we need to prepare in case.
Yeah.
So Erla and we'll work together and see if we can figure out a day we can both go out there, even though Erla works nights. Hopefully we'll figure something out.
I'm off all next week.
You're off all next
week.
Perfect. We'll go next week sometime then. And we'll see if we can figure out. Okay, moving on. If no one else has any other comments on the health department overtime, we will move to miscellaneous. And I have a couple of things, but does anyone have anything before I start going on my spiel? Anyone? Okay. First thing on my agenda for the miscellaneous is Pam forwarded us a letter from NDOT maybe for an environmental review over a NDOT project. They're asking for comments from the county council for some odd reason. I've never seen a fiscal body or legislative body be contacted for an environmental review. But does anyone have any comments on that proposed project and any effects it might have?
I printed it out. Hell, it's about 30 pages long.
Yeah.
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 I stopped it.
Yeah. I was like, does anyone have, I mean, we can send a letter that says we do not believe this will affect us, or I can reach out to Steve Howell.
Is it more or less, are they needing?
We can write a letter in support of it.
That we support it, right? Because I know whenever I was on Cannleton, anytime we did something like that, they just wanted letters that this was going to help the community or the residents in that area, and it was much needed.
Well, this is an environmental review, so it's like they send letters to like Department of Natural Resources, IDEM, like that's kind of more what environmental reviews are for.
Yeah, I saw it about the.
Yeah, so. Teresa, do you have any comments on this?
This is just a standard procedure that they have to do during the project. They have to give a period of time for any possible affected people, entities, organizations, etc., to have a period of time to comment if they feel that this project would adversely affect the environment of the area of the project.
Right.
I don't really think they're asking for anything if you don't have any comments to make. I would think Steve Howell, the highway and superintendent, would be the one to contact, and
yeah, that's kind of what I was
familiar
thinking.
with the area. If he feels there's an issue, I think he would be forthcoming to let you know that.
Yeah, I'll reach out. Yeah, I'll reach out to Steve. I've never seen a fiscal body, consulted for an environmental review. That's new to me.
Yeah, they
And
sent it out to several different people, as you saw on the letter.
Right. Yeah. I mean, it makes sense to reach out to the environmental organization groups and agencies, but that was something new. I've never seen that before. So I will reach out to Steve if everyone's okay with that, and I will send a response, I guess, and based on his comments, if that's okay with everyone.
That would be great.
Great. Another thing, as I sent in an email, but I just want to make this public. The Indiana House of Representatives has passed, I believe, now I don't remember the bill number.
1271? Is it 1271?
It's something like that. Hold on a second. House Bill, oh my gosh. Oh wait, here it is. Yes, it is 1271.
Pretty good for an old man, isn't it?
Yeah, you're an old man with gray hair and you can remember that. Good job. The House of Representatives passed the House Bill 1271, which is a Department of Local Government Finance bill. Tacked onto that was our amendment to change the Perry County special legislation tax language to allow all excess funds to go to a jail maintenance and operation fund. So now that it's going to go before the House, and I will reach out to Senator Houchin and ask her to support that bill. I don't imagine any problems because it's a DLGF bill, so I'm sure it'll be passed. But I just want to make the public aware that, and everyone aware that that bill is passed with our amended language. And we weren't the only county to do that, actually. In the same bill, Marshall County did the exact same thing. They changed their detention center language to go to their detention center, like thought it should be. So that's an update there.
Thank
Also,
you for getting that all rolling on that.
yeah, no problem. I'm glad. I think it's going to be a good move for the county, and it'll
think
put
so.
us in a much better financial position to fund the detention center for the foreseeable future. And those bonds can be paid off in January 2023. And then those funds would transfer over to a county detention center, jail, or jail maintenance and operations fund. So I think that's a good position for the county to be in for the future. So I'm glad that hopefully will pass the Senate and the county will be in good shape for the future. Another thing that I want to bring up is I forwarded everyone a offer of consulting services from Wagner Irwin Shield and Associates to complete a job description and compensation study. The reasoning behind this is with COVID, it's going to be affecting our 2022 budget. I don't see how we're going to afford to do a raise for the 2022 budget. I mean, our revenues are going to be down. And that would be 2 years in a row that we probably would not be able to give a raise to our employees. So I thought it would be a good idea to look into having a compensation study done. So after we recover from post-COVID finances, we can have a plan on how to provide raises for all the county employees.
What kind of cost?
So originally it was going to be, he sent me the scope of services and it was $24,000, I believe. And I was like, holy crap, I did not expect that. But then I asked Pam, and the personnel policy handbook cost over $9,000 to do. And so now we're asking for a study of 94 employees and job description. So I think the cost would make sense, but I asked him, he called me last Saturday and we talked about it. And he said, I can split this over 2 years. So it wouldn't be, such a big cost in 1 year. And I thought that's probably a good idea. But the first phase would be updating all the job descriptions, which he said they updated the last time they did them was 2009. So they haven't been updated for 12 years now. And so they can't do a compensation study if the job descriptions aren't up to date because they use a factor evaluation system that is a quantitative value for judgment on relative worth of jobs. I sent you all this information. He breaks down everything and what it should be or what it does. And then they would, after the job description was updated, they would do an internal study to see that people in the county are earning equal pay for equal work. Then they would do an external analysis, compare us to other counties and public organizations and see where we should be. And then they would provide us with wage and salary cost projections on how to get there over the years. And like I said, without giving another raise, and the 2019 we gave a $750 stipend. You know, the employees haven't seen a real raise in a while. So I think it'd be a good idea to have something in place to where we can provide a roadmap for future raises. And then after we get those salaries up, he said this can be used to continually, you know, update job descriptions and salaries. So it's more of like it's a tool for us to use to be able to provide raises in a uniform and objective fashion. Not that I think, you know, salaries or anything it's political, but I think it'd be nice to have something factual and objective to work from for salaries. So it would be broken up over 2 years. And it's not, the first phase would not surpass $14,000. That's because it's not a lump sum contract. It's hourly. It's on an hourly basis. So since I sent that out, I mean, I got to you Monday, but we didn't really get a chance to discuss it. So if no one's comfortable in acting on that, we can postpone this to our next meeting and go ahead and I can put in an additional appropriation request for the next meeting. Or we can do a motion of intent now, but I figured the Riverboat Fund would be a good place to fund that from. It's got, David, what does that have in it, you said?
138,000, wasn't it?
Something close to that, I think. And so it'd be a maximum of $14,000 this year. And we'd have the job descriptions updated, the FLSA analysis done, and the point factoring analysis would be done this year, I believe.
Luke, did he give you any counties that?
Yeah.
This far?
We talked for a while on Saturday, actually. The most recent one, he said Rush County did this this year or last year. They did a job description and compensation study, and it was $22,000. I believe it said $22,000, and they split it over 2 years because they didn't want to take on all that at once either. But I can give him your contact, or I can give his contact information to everyone, or I can ask him to come to the next meeting and kind of explain it if everyone thinks that's a good idea, maybe.
Well, I wondered if checking with one of the counties that they've done this for, how that would be.
Yeah, I could reach out to I can reach out to him and ask him for a couple of people who've done it before. So if we don't want to act on it now, we want to just do a little bit more investigating. We can put this on the agenda for next month if everyone's okay with that.
Let's do that.
Okay, yeah, I don't want to rush. I mean, it's a lot of money. I mean, $14,000 is a lot of money. You know, I don't want to throw that on everyone, but I think this is something we should definitely look at. And I can see if he's available to come to kind of explain it a little bit more, because we talked for a while and he really explained it and the process and the purpose. So I can see if that's possible. But so I will ask. Go ahead, Pam.
Did you say you were looking at the Riverboat?
Yeah, Riverboat Fund. Yeah.
Make sure I had that right.
Yeah. So I will see if he can come to our next meeting or if he can provide us with some more information. But I think, like I said, with us probably not giving another raise this year, I think it'd be a good idea to have a plan ready for post-COVID finances to help out our employees. So I will put that on the agenda for next month, and I'll let him know all that information and see if he can help us out a little bit more. Anyone have anything else?
I was wanting to approach the council to ask permission on some grant that we are wanting to go after.
Sure. I mean, what all are they?
2 grants are local grants. They're equipment grants. They are no match grants. One is going to the Substance Abuse Committee, and the second is through Perry County United Way. The third grant is a state level grant. It is a stop arm violation enforcement school safety grant, and it is administered through the Indiana Criminal Justice Institute. This is Charlie might remember some of the Operation Pullover grants, and those days. It's similar to that, but it's not necessarily like Click It or Ticket or Operation Pullover. This particular grant is just for school zone safety enforcement, traffic enforcement in school zones. Particularly, we would partner with Perry Central Schools. And the other major point that the pragmatic reporting will be looking at school bus safety arm violations. So we would be following some school buses around looking for violators of the stop arm violations. It is funded through the Indiana Criminal Justice Institute, but I found out today through a training course that FICA is not covered. That is something that we would 7.65% of the salaries that would go for this would be our responsibility. And it's after speaking with Pam today, seeking some of her advice, it looks like maybe retirement fees might be something we would have to come up with. Outside of that, though, they're going to pick up the cost for the pay for this particular grant.
Gotcha. Does anyone have any questions or comments on this?
How much are we talking about as far as the salary?
I told Pam on the phone today, I hope to have some raw figures tomorrow. I was really hoping to have them today for you, and I don't have them. I'm thinking that I will probably have them tomorrow. We don't anticipate it being more for the 7.65%. We don't anticipate being more than $1,000. But I will have more definitive figures to give to Pam, and then I could obviously email the council tomorrow afternoon.
And this is a no match.
This is a no match. This is a no match grant that pays overtime to the deputies. The state will pick up the fees for salary. The only thing that they didn't cover was the 7.65% for FICA, and then the retirement is the only other portion of the salary that they won't pay. They won't pick up the fees for that.
Gotcha.
Eric, do you have? I'm sorry, go Pam.
Well, if I was going to add in to Eric's, when me and him talked, like I told you guys, even with the Social Security, we had some extra in there from last year. And since we didn't do raises, I anticipate that hopefully we still will have extra, even with the stipend and everything. But we'll keep track of the Social Security to see how we go. So we won't have to appropriate for that. We'll just take that out of the regular Social Security line that we have now. Now, the retirement, which theirs goes under sheriff's pension and not the regular retirement. My kind of understanding from that, just because of some other situation we had with the cops thing, we probably won't see that hit until next year, because I have to certify their salaries at the beginning of the year to the company that, as far as with the sheriff's pension, for them to figure out what our costs are. So we probably won't even see this extra what we have to come in until 2022, maybe even 2023. As far as that goes under sheriff's pension and not regular retirement.
Okay, Eric, my question is there a deadline for this grant?
Unfortunately, yes. And I found out that the deadline for this thing is noon tomorrow.
Well, you know, I'm in all favor of them applying for grants. I think, you know, we should approve this.
Well, we don't have, you know, we discussed having a procedure for grants, which we never, that still hasn't been, that hasn't been, you know, passed or anything. So I appreciate you coming for us and even just telling us about it. That's what we want. So you don't need permission from us technically, but I appreciate all the information.
Yes.
And I don't think it'll be a problem for us to, if, you know, we will doing the transfers and not having to appropriate for it. I think we'll be okay, but I appreciate you bringing it up to us. That's what we want to happen. But speaking of that, I think that's something for the council to go back on, to put standard procedures in place like this, like just like what they did, you know, just come before us and tell us about it. So that's another thing for us to consider, but I say go ahead and platform.
I do too.
I agree.
Yeah. So I really appreciate it. Anyone have anything else? If not, people watching on YouTube, thanks for tuning in. Everyone, thanks for your discussions tonight. Good meeting. I will entertain a motion to adjourn if no one has anything else.
Got one thing.
Sure.
I'm
Sheriff?
sorry, I always try that.
Sheriff?
Eric, can you explain what we just got a grant for just yesterday? It's all 100% paid for, but just let the county know what we just got yesterday given to us.
Yes, absolutely. That's good news. I actually forgot. We're the recipients of 3 AEDs from the Heart Group, based out of Deaconess Gateway Hospital, and those 3 AEDs are going to go into our deputy sheriff's police cars. A lot of times we can get to a scene sometimes quicker than even EMS, and being an officer that has used one of these and actually had to save with one of them in the field, I am 100% an advocate for this. The ladies at the Heart Group that presented these to us believe in the program. They have issued out more than 465 of these to the tri-state, and they're not going to stop until every public safety first responder has one of these in their cars. So we were very, very happy to receive that.
It's awesome.
Excellent. Yeah.
Anyone else? All right, I'll entertain a motion to adjourn.
Motion.
Do I have a second?
Second.
I've got a motion to adjourn. I'll take a roll call. Charlie?
Yay.
Danny?
Yay.
David?
Aye.
Lynn?
Aye.
Paul?
Aye.
I'll vote aye as well, and Erla.
Aye.
Motion passes 7-0 to adjourn. Thank you, everyone. Great meeting. Thanks for joining in, people on YouTube. Congratulations on your grants. Sheriff, we're glad you're back. Eric, thank you all for your work. Teresa, thanks for all this. We will meet soon, I guess. All right. See you
Have a
guys.
good evening.
Yep, you
Thank
too.
you.
Aye.
Bye.